In this video, we'll be discussing few more multiple choice questions in microbiology. So starting with human immunoglobulins are divided based on functional differences, structural differences, complement fixation, none of the above. So before that, let's briefly see various types of immunoglobulins and the differences between them. So starting with, basically any immunoglobulin has a light chain as well as a heavy chain. So any given immunoglobulin has two light chains and two heavy chains, and these chains are bound together by disulfide bonds. So an immunoglobulin has two light chains and two heavy chains which are bound together with disulfide bonds, and based on the difference in structure of this heavy chain, we have different classes of immunoglobulins. So these heavy chains or H chains are structurally different and also antigenically distinct for each class of immunoglobulin. So let's see various classes of immunoglobulins, starting with IgG, IgM, IgA, IgE and IgD. So G stands for gamma, M stands for mu, A stands for alpha, E stands for epsilon, D stands for delta. So this is because of difference in the structure of the heavy chain in various classes of immunoglobulins. So now moving on to the question, human immunoglobulins are divided based on, as discussed, structural difference, right? And then the binding site for complement on the immunoglobulin molecule is in option A, VL domain, CL domain, CH1 domain and CH2 domain. So before answering this question, let's briefly see the structure of immunoglobulin again with respect to its binding site. So any immunoglobulin has FC site and FAB site. So this FAB site, it's antigen binding site, whereas FC is complement binding site. So this FC is the insoluble fraction, whereas FAB is the soluble fraction. This is just for your information. So complement binds to the FC end, that too in CH2 domain, right? So now moving on to the same question. So the binding site for the complement on the immunoglobulin IgG molecule is CH2 domain, which is present on the FC portion of a IgG antibody. So the structure of immunoglobulin is very important. Once you understand the structure, you have several multiple choice questions from that aspect, right? And to note another point here, IgG is the only immunoglobulin that fixes complement, whereas other classes of immunoglobulins do not fix any complement, right? Now moving on to the next question, IgG antibodies have half-life of approximately 1 hour, 1 day, 1 week, 1 month. So let's briefly see the half-lives of various classes of antibodies here. So T half. For IgG, it's approximately 23 days or 1 month. For IgM, it is short-lived, T half of 5 days. For IgA, it is 6 days, again short half-life. For IgE, it is around 2 to 8 days. And for IgD, it is 1 to 5 days. So these are half-life values of various classes of immunoglobulins, right? Now let's move on to the same question. IgG antibodies have half-life of approximately 23 days, or the best answer here is 1 month, option D, right? Now moving on to the next question. IgG has subclasses. I have discussed the same in the previous videos, right? So IgG has 4 subclasses, 1, 2, 3 and 4, and their concentration varies. IgG1 has a concentration of around 65%, 2 has a concentration of around 23%, 3 has 8%, and 4 has 4% concentration, right? So of all the antibodies present, IgG is the most abundant serum immunoglobulin, accounting 80% of all immunoglobulins present in the serum, right? So the option here is 4. We have 4 subclasses. So now moving on to the final question. First released immunoglobulin after primary immunization. So of all the classes of antibodies, IgM is considered to be the oldest immunoglobulin because it is the first formed immunoglobulin in fetus in response to any infection, right? So, and moreover, the half-life of this IgM is very short. It's approximately 5 days. So in diagnosis, if we come across IgM in serum of fetus or newborn, it indicates that there is a recent infection. So this infection can be either intrauterine infection or can be congenital infection such as HIV, rubella or syphilis. So presence or identification of IgM clinically in serum has many diagnostic implications, right? So IgM, considered to be the oldest immunoglobulin, is the first formed immunoglobulin in response to any infection, right? So the first released immunoglobulin after primary immunization is also IgM. So these are few more model questions with some notes, with some useful points. Hope they're useful for you. And to summarize, we have various classes of immunoglobulins, and this is based on the structural differences of the H chain. So we have gamma, mu, alpha, epsilon and delta antibodies, right? And we have 2 binding sites for any antibody like FC as well as FAB. FAB is a soluble portion, AB stands for antigen binding site, whereas the FC, it's a complement fixation site or complement binding site, and complements bind to the CH2 domain which is present on the FC portion of any given antibody, right? And then the half-life of various antibodies as you can see here, and every antibody has 2 light chains and 2 heavy chains which are bound together with the help of disulfide bonds, right? So these are few important multiple choice questions and the relevant points.